Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana Hurrenque if you're new here, and if you're not, thank you for coming back. Today is Monday. I think we can't forget when it's Monday, right? We wake up and it is Monday. It is Monday, July the 26th, and today I am joined by what might be a familiar face to you if you're familiar with AL.com, and this is our columnist, Cameron Smith. And Cameron wrote an interesting column this morning that is kind of a follow-up on a column he wrote about a week ago. And this morning's column is about personal liberties and the COVID vaccine. So with all of the news happening late last week over the weekend about coronavirus in Alabama, we had Governor Ivey's comments. We had several Alabama medical experts come out and make statements about COVID and the Delta variant. I thought this would be a good time for Cameron to come on here and kind of explain his position and explain his columns again about balancing that personal freedom and those personal liberties and the COVID vaccine. So Cameron, thank you so much for taking time this morning to kind of break down your column. I know you just published it, but I know that it's going to be one that people talk about. So I think we should just get ahead of it.
Sure. I think this is a big issue right now. We've seen the spike in the Delta variant, and it's heavily amongst unvaccinated people. And we're in a situation right now where it's sort of, what do we do now? We have literally tried to bribe people. In Arkansas, a Texas man won $1 million off lottery tickets that were given away with the vaccine. California has given away vacations. In Indiana, they even gave away Girl Scout cookies for vaccinations. I mean, we are bribing people. If you're an adult in America and you don't know that, one, COVID is serious, potentially lethal, and easily prevented with the vaccine, I can't help you. That information's been out there. The idea that misinformation is just too much and we can't discern what's real and what's, Billy Bob blog is silly. Adults in America know what's going on right now. And we've got a large chunk of the population that's basically saying, I am a free individual. I've looked at it. I've heard what you had to say, and I don't want to do it. And my first piece was saying, and they need to live with the consequences. That is part of liberty in America. Immediately, I got pushback and people said, well, but we all the time restrict liberty. We all the time tell people, here's what you have to do. And to that I say, yeah, absolutely. We make these judgment calls all the time. I mentioned, for example, tobacco-related illnesses. Cigarettes kill almost 500,000 people every year in the United States alone, yet we still allow tobacco consumption. So there's choices and trade-offs between liberty and government control. And we're really still in a free society. The whole process of America is how we sort that out, how we balance your freedom to do what you want versus what's in the best interest of society. And there are trade-offs. And in this situation, we're at it again. And frankly, that's why America works.
Well, and you had that call again about a week ago saying there's no vaccine for individual liberty. Then this morning you follow up with a column saying it's about balance. It is about balance of personal liberty and balance of a vaccine. And I know that you write in there that a COVID vaccine mandate is a lot.
Yeah, I mean, here's the thing. At this point, I think people have made up their minds based on available data. They've already said, here's what I think about the COVID vaccine, and I'm going to take it or not. And it may just be, I don't want to. I mean, it may be that simple. But in a civil society, we do say, okay, we think you need to. We think a lot of people are going to die if you don't. And so that we're balancing something like a vaccine mandate. And we say, we're going to force you to do it or there are going to be penalties. Well, we don't just do that unilaterally. Our elected officials sort that out and decide on these things. And then if we don't like it, we kick them out. That's the process. So, for example, the votes aren't there for a vaccine mandate. That just simply isn't there. But something like, hey, you need to wear masks in schools, it might be, and officials might go along with that. But again, if people don't like that, if they say this is not how we want our officials to govern, those officials will be gone and then we'll get new ones. And that's actually a good thing. This is how this works because we really don't agree here. Some people say this mandate, we should mandate this. It'll save a lot of lives. Some people say, I don't want to do it and I'll take the risk. You can't square those positions because they're at odds. And so that's why America's really awesome, is that we, the people, still decide those.
Right. And, this is an interesting topic to talk about, especially after on Friday, Governor Ivey's comments of saying, look, it's time to start blaming the unvaccinated people. She says, I don't know what else to do. I think there was even a comment that kind of went viral on the internet of a reporter saying, what else can we do? And she said, well, I don't know. You tell me. And it did seem that she's a little bit annoyed at this point of this question. She's a little bit annoyed at having to say, I don't know what else to do. Kim, what's your take on that?
Yeah, well, some folks have suggested, well, she's afraid. She's afraid of. Look, Kay Ivey is not afraid. Kay Ivey did shutdowns when they weren't popular, extended COVID rules when they weren't popular. She's coming out now and say, hey, you unvaccinated people, you're the ones that are causing a lot of this problem. And the evidence actually bears that out. That's who's getting sick. That's who's filling hospital beds. It's not people with the vaccine. And so Kay Ivey is not afraid, but I understand the frustration of saying, what else do you want me to do? I've put the information out there. Alabama Department of Health has put it out there. And this is my contention that at this point, you have two choices. You can either mandate a vaccine or you can let people live with the consequences of what they're doing. And I concluded my second column by saying, Patrick Henry famously pointed out, give me liberty or give me death. In this case, people may get both. They may get their liberty and bear the consequences for their choices. And that's just part of life. And I know that that's harsh to some people, but we cannot jump in every instance where somebody's making a potentially horrific decision and say, we need government to regulate. And where we end up in that balance is America.
So correct me if I'm wrong, Cam, but this is kind of what it sounds to me like you're saying, especially with that quote that, again, is in your column and I thought was very interesting. And I'm just going to repeat it. You quote Patrick Henry, saying, give me liberty or give me death. And you say that some unvaccinated Americans might get both. So Cam, is kind of your point here saying, look, the people have the choice. They can get vaccinated or they cannot. If they choose not to, there's nothing else to do. They have made their choice and we should not go out of our way and you, as your words, bribe them or do other things to force them to get a vaccine.
Yeah, I mean, let's not be patronizing here. These aren't children. Like, children are a separate issue. I'm talking about a lot of the eligible population that are basically adults who are saying, no, I don't want to. And there are reasons. They could say this was put forth under an emergency use authorization. There's not a lot of longitudinal data, so I'm just not sure I'm a healthy individual and I don't want to do it. I still think the risk is relatively low and it's something they should do, but I understand that position that's fully irrational, saying they don't want to. The question then becomes, are you going to force them anyway? Are you going to tell them you must do this thing you do not want to do? And right now, I can tell you in Alabama and frankly, the United States, even in very liberal states, the appetite for a vaccine mandate is very low because people kind of get it. And even those who say it's a good idea, you should take the vaccine, count me one of those. I am telling you, it's a good idea. It's very low risk for a potentially significant benefit. Oh man, the idea of mandating you must take this thing, that I can tell you the politics are not there to support that at all.
I want to ask you, and this is a comment here from somebody watching in the audience, and I've seen several that are kind of like this comment as well. This is from Michael. He says, it's not just about individual freedoms. If you don't get vaccinated, you are putting your own personal selfishness over the freedom of everybody else. Love your neighbor as yourself. What do you say to that sentiment from Michael and people who are expressing the same thoughts?
Sure. I actually got a lot of feedback of this, and then I used some examples from our current society, the tobacco one being a good one. People say, well, tobacco is sort of, victimless because it just hurts the individual. That's not true. It creates a public health cost. So Medicare or Medicaid, when they're dealing with somebody who has lung cancer because they smoke cigarettes, everybody else has to pay for that. Then when a family member is lost to that type of preventable illness, everybody else has to deal with that. And so the idea that, well, as long as it's only you, well, there are very few things that are only you. And we make these decisions routinely. I'm not suggesting that, I'm not arguing in any way with the person who says, well, an individual liberty here will cost other people. But what we are seeing from the data is the other people it will cost are primarily the people who made the same decision. So we can see Alabama, I think it was 96% of the folks that are having bad reactions to the Delta variant are unvaccinated. And so I'm a little less sympathetic to the public health argument when it's the cohort that's impacted the greatest are the ones that are making the same decision. At some point, it probably has to click and say, wait a minute, the people who are vaccinated aren't getting as sick if they do get COVID, and most of them aren't. The rest of us are. man, maybe there's something to this. I shouldn't have to bribe you to be rational about that.
Do you think we're at a point, Cameron, of we know that the governor has said, look, I don't know what else to do. You tell me what to do. Cameron, do you think we're at a point in society, and in Alabama especially, where we have put out enough information about the vaccine? We have seen our public or local leaders. We've seen our national leaders. I know you and I were saying before, you've seen former President Donald Trump and current President Joe Biden both speak out in support of the vaccine. We have seen our public officials, Governor Ivey. We have seen the Alabama Department of Public Health. We've seen a lot of people speak out. We've put out this information. Are we at the point where people need to make their own decisions and there's nothing else we can do to tell them that?
Yeah, I mean, I think that's obvious. And a lot of folks say, well, they should, to which I would say, you should get vaccinated. I agree with you. Okay, now what are you willing to do? Are you so emphatic here that you believe we've reached the point where it needs to be mandatory? And if the answer is no, then yes, we're kind of at the high water mark of what we can do and how we can engage folks. The question that we're going to see pop up here is, okay, well, should we reinstitute some rules to kind of get people to space out, like the less invasive type stuff, strategic shutdowns, mask mandates? I can tell you, most folks are over that. They are saying, I got vaccinated on the promise that things would be opened up, that I could do a lot of stuff, that I could be free of all that jazz. And the idea that half the population in some areas has said no, and they're the ones that are going to be impacted. At what point do we say, hey, that's your personal responsibility? The consequences are on you, because should the rest of us have to go to, more mask, more shutdown, stuff like that? That's equally unpopular in my estimation.
Well, and I'm glad you brought that up, because that's a good point. The kind of promise, I believe this was made in May by the CDC, of saying, look, you got vaccinated, you don't need to wear your mask. You don't need to worry about social distancing. That is the point of getting the vaccine, right? Well, then you fast forward to now, end of July, and we've got a lot of places across the country that are saying, look, we might need to go back to mask ordinances. We've seen some places across the U.S. have gone back to mask ordinances because of the spread of the variant, because of vaccination rates not being where they wanted them to be. So how do you balance that with telling vaccinated people that you just told them a few months ago, hey, you don't have to wear your mask because you're vaccinated? Well, now fast forward, oh, you do need to put it back on possibly because people have not played their part. How do you kind of reconcile that?
If I'm in politics, I don't. I mean, I think that's the challenge here, is people relied on that. And I think you actually hurt your vaccination efforts by doing that kind of stuff, because people just say, look, they're going to shut down stuff. They're going to make us wear masks. We're going to have to do all that anyway. Why do we need to go get a vaccine on top of that? I'm not suggesting that's a good argument. I'm just telling you what's going to happen is people look at it and they say, I'm tired of this. I've been asked to do this stuff. I have complied. And now you're telling me we're back to square one. And I do not see folks doing that. I don't see us going back to shutdowns. I do see mask mandates in schools and other places making a comeback, and how popular those will be, it depends on the jurisdiction. But for example, in Alabama and in the South and in these states where half the folks aren't vaccinated and not interested, I just don't see that being popular at all. I just see people being mad about it, and politicians are responding to the majorities. That's what they should do. And I think Kay Ivey's done about as good of a job as you can in trying to navigate the political realities against the scientific ones.
I'm looking through some of these comments, and here's an interesting one. And I've heard people say this kind of same sentiment, maybe in different words, but I like the way that he phrased this. This is from Joshua, and he says, the goalposts are always going to move further away. A touchdown is never going to happen. I've heard a lot of people, and I'm sure, Cam, you've heard from these same people who kind of express the same thing. I just like that analogy of saying it's going to keep getting further and you're not going to get to the goalpost. And, what do you say to that?
I agree. I think that's where, and I understand some of this is because of the reaction to something that we really haven't encountered, right? A significant pandemic, highly infectious. In our generation, we just really haven't dealt with something quite like that in the United States. And so there's been a lot of mixed messaging. And I think that's been a huge part of the problem. You can blame the Trump administration, you can blame Dr. Fauci, whoever you want, but our government officials have been kind of all over the place on this. And the responses have varied from state to state. in terms of how shut down things were or how they weren't. And I think what we need to do is relax, look at where we are, look at the tactics that worked and didn't work, and kind of try to respond strategically, knowing that people are reluctant here. And I don't think the votes are there for a mandate. So the answer may be, we're not going to do a mandate. We're not going to push, but man, you've got to be careful here. We're back to washing hands. We're back to, bacterial stuff and anti-germ stuff everywhere. That's probably sort of the compromise we're going to end up, and hopefully we can avoid some shutdowns.
Cameron, I know you write a lot of political columns. That is one thing that you consistently do for us here at AL.com. So let me ask you this directly. Is COVID and is the vaccine political?
Is COVID political? No. COVID exists in the world. So by definition, it's not political. It's not a situation where Republicans said they made COVID or Democrats made COVID. How we've responded to it is definitely political, because we've seen this as, well, who's asking who to do what? We've seen President Trump's response, which is, look, we did this warp speed thing where we got this vaccine. It was a big, beautiful vaccine. And then all of a sudden Biden comes in and it's like, well, we're skeptical about it all of a sudden. And we need leaders to do basically what Ivey's doing, saying, get a vaccine and engage. What's really weird right now is there's no one credible that's not telling the truth. There's no one saying, don't get the vaccine or you get magnetized. Don't get the vaccine or you'll be sterile. No one is saying that. And so that's what's made it a little weird, is it is still political, but the political leaders are basically kind of doing the right thing here and saying, here's what the information says, do with it as you will. And yet we're still very much, this is very controversial. You can see in the comments right here, people are very much like, are y'all nuts? Are y'all nuts? Y'all are all crazy. We need to kind of tone it down, look at this stuff seriously and see, hey guys, what's the best response to keep our schools, economy open and keep people healthy?
Well, and I'm glad that you said that. It kind of brings us back to an earlier point of saying that credible and elected officials, you can even, I feel like some people do not view the word credible the same anymore. So let's just say elected officials on either side of the spectrum politically are saying the same thing. Again, we've got former President Trump and current President Biden saying vaccine safe, take it. We have Governors Ivey, we have Governor DeSantis in Florida, very conservative, saying you need to get vaccinated. We have people on both sides. Now, one other comment I wanted to make to you, Cameron, and that is somebody named Joseph. And I think that a lot of people share his view as well. He says, without question, freedom is more important. I think saying that personal liberties and personal freedom that we were talking about is more important. And I am vaccinated by my own choice. And I think that kind of sums up this conversation pretty well. It is a personal freedom issue, but you can make the choice to be vaccinated or the choice not to be vaccinated. I feel like that sums up your column very well.
Yeah. And so what's really interesting here is America needs the people who are emphatically watchdogs of individual liberty, that are the people who are like, no, I'm suspicious of the government. I don't like the government. I don't want the government telling me what to do. We need those people, because on the other side are people that say, it's common sense. We should create another law or mandate or make government do a thing. And so that tension of we the people is necessary for America to strike that balance. Like, that's really, really important. So I understand that the person that's like, yeah, we need vaccine mandates, you're an idiot for not taking it, feels that way and feels like they're the righteous one. And the one over here that's give me liberty or give me death feels like the righteous one. But in America, it's having these people, neither of whom are particularly righteous, that strike a balance that say, here's what we're going to do. And so it probably makes everyone a little bit uncomfortable. We end up with maybe, masks in schools and kids thinking they're Batman and kind of having fun with it, but no vaccine mandate. There's a lot of different formulations this can take, but just remember that person on the other side that you think is insane, they're the balance. Like, you are striking a balance with them, pulling in opposite directions, and we get probably the best result that society can hope for. And you don't think that, you don't feel that, but like, literally, America is the best, is the worst system except for all the other ones.
a little bit of civility on all sides, and every conversation is a good rule to go by. That is never going to hurt you. Cameron, thank you so much for kind of breaking this down for us. I do want to say to everybody who does have questions on vaccinations, whether you want to know where you can get one, whether you have genuine questions about your personal situation that you want answered by a medical professional, etc., we have set up an email address. It's vaccines, VACCINES, plural, at AL.com. You can send your questions there, and we will do our best to get them answered for you. So, Cameron, again, thank you for coming on, explaining this. We're going to link your columns here so people can go give them a read, and I'm sure you will have plenty of feedback that you can wade through later.
Thank you very much. And hey, if you want to give me feedback, click on my email in the column, shoot me a message, tell me what you think. I'll do my best to get back to you.
Thank you so much, everybody watching. Thank you. Please be kind to each other out there, and we'll see you tomorrow.